We welcome you back in time for our Ask the Doctor segment. And today we are talking about new methods of contraception on the market, what's out there today. Dr. Farinna Willis, an obstetrician gynecologist at Brookwood Medical Center. She's here today. Good morning.
Good morning.
It's good to see you.
Nice to see you.
I would imagine there are a lot of things on the market that a lot of women aren't aware of if you're not seeking to get something right now for contraception, right?
They're coming out with new ideas for contraception every day.
What is the challenge that the new ones are trying to face and are trying to make changes from what we're used to?
Well, what we're actually trying to do is to help with non-compliance, people who might be on the birth control pill and might forget to take a pill, or people who for some reason can't take a birth control pill, such as for reasons like hypertension or diabetes. There are other options that are available for them.
All right, we apparently are having some phone trouble, but I understand we have gotten some of the calls in, and we have the questions for the people who are on the phone, so we can still do the questions. So I'm going to read the question for you. This is Brandy from Sylacauga, and she says she just started taking Seasonal, where she only has 4 cycles a year, but her breasts are extremely sore and they're large. Could this be too strong, the Seasonal?
Well, it's not so much that the Seasonal is too strong. What it could be is a side effect of the progesterone in the Seasonal that causes breast tenderness and enlargement of the breast. If it's really bothersome to her, then she needs to talk to her physician and see about possibly doing another type of birth control pill. With Seasonal, which I have here,
that it?
This is Seasonal. Okay. What it is it's 3 months of birth control pills supplied as one. And we've been doing this for years, where we can tell women no longer take the placebo week, the last week of the birth control pills. Instead, just go to a new pack.
Really?
And you can do that with just regular birth control pills.
What difference does that make? To do them in the 3-month pack? What is that trying to do?
Well, what it does is it limits the amount of cycles that you have a year. Thereby, you don't have cycles every month. You only get cycles 4 times a year.
Really?
Every 3 months.
There's a lot of women going, that's what I want to look into. Is this for everyone, though, or is it like everything? You need to find out what fits your body. You
do have to find out what fits your body. One of the things we do know about trying to do birth control 3 months in a row is that you can have some breakthrough bleeding. And you have to be willing to accept the odds that you might have that breakthrough bleeding until your body figures out what's going on with trying to stop you from having cycles every month.
I know for years, and some people said this was a myth, that people said, I don't want to get on birth control pills because I gain weight, it doesn't make me feel good. Is that a fact, or is that just something that we felt?
No, actually, depending on the dose and the type of estrogen that's in the birth control pill, it can cause nausea, or it can make you feel a little bit, the progesterone more likely, to make you feel a little bit overweight, where you put on water weight. Okay. And now we have new pills like Yaz, which has drospirenone in it, and this actually acts as a diuretic. So that you can get rid of that bloating sensation that you get around the time of your cycles. It also helps with PMS syndrome.
Now, how do you, when you're talking with your doctor, what kind of questions do you need to ask if you're looking for the right contraception for you? I mean, you don't want to try everything on the market, do you?
No, you don't. Actually, it's more of the doctor should be taking a thorough history and physical, because we need to know if there's any background medical problems that we need to be aware of, because that determines what type of birth control option we might offer to you. But some of the questions that you might want to ask is, how often do I have to take it? Is it something that I'm going to have to do myself, insert something for birth control, or am I going to have to come in and get an injection? So
really have a thorough conversation with your gynecologist.
Definitely.
All right, Dr. Willis, thank you. I apologize, we had phone problems, but I think you answered a lot of the questions that perhaps some of our viewers would have.
Okay.
Thank you very much.
Thank you.